There is a study called the Octave Duo study, which is essentially a vaccine booster study. So in this study, we are looking to recruit over 1,000 patients across the UK with various reasons of whereby which they're immunocompromised. So as part of this cohort, there'll be a group of blood cancer patients. We have focused on patients with lymphomas, specifically because these tend to be the group of patients where we have seen the most impaired antibody responses. And I want to kind of probably quick kind of reply to Dick Morris on the chat as well. So people with MPNs, the myeloid disorders, seem to be all right in the sense we see generally high response rates. Again, it depends whether you had treatment, etc. And but again, still small numbers, so needs kind of validating. Sorry, I deviated there. So in this Octave Duo study, we are looking to recruit some 300 odd patients with lymphomas. They will have had at least 2 doses of vaccine, and we're going to test the antibody levels. If they have no antibodies, or what we have arbitrarily, I have to say, selected as low antibody levels, then they will be randomized to 3 vaccines. And the ones that we're actually testing are the Pfizer vaccine and Moderna vaccine, and another protein vaccine called Novavax. This is one of the approaches. And so the aim of this study really is to guide the government about their booster program in September. So it's really moving really fast. If some of my patients are on the call, it may be that I've spoken to you in the last 24 hours and I will be speaking to you again. But yeah, so that's one of the things we're doing. There is already some early data about booster vaccines. So a couple of groups have already published really small numbers. There's one case of one patient with lymphoma getting a booster vaccine after having no response after 2. There's another cohort of studies in renal transplant patients, I think. I can't remember quite at the top of my head. But essentially, we are seeing that there is a chance of changing. If you don't have antibodies, there is a possibility that we can induce a response by giving a 3rd vaccine. The questions remain whether this should be a different vaccine, obviously, but I also think it will come down to the nitty-gritty question of why don't you have a response in the first place? If it's purely because you don't have a response because you were vaccinated whilst you're in treatment, that's straightforward. That's something that we can rectify with further vaccines. If there is something inherently because you have a cancer of the immune system, and your immune system is just not good enough to, mount an antibody response, then this is where Provant comes in, and where our understanding of the importance of the T cells is really required.
And what I do want to read to you just quickly is the kind of interim advice issued by the JCVI, which is the Joint Committee for Vaccination and Immunisation, and they've issued some kind of interim advice on what will happen to the booster programme in autumn. And they've said the following person should be offered a 3rd dose COVID-19 booster vaccine and the annual flu vaccine as soon as possible from September 2021. And that includes adults aged 16 years and over who are considered clinically extremely vulnerable first and foremost. So people with blood cancer will be in group 1, they will be prioritised for the vaccine. And then in group 2, it includes adult household contacts of immune suppressed individuals. So if you live with anyone aged 16 or over, they can also be prioritised of the booster vaccine. And that's to protect kind of you and make sure there are people protected around you. So yeah, that's the advice at the moment. So we'll keep you updated with that as and when we get more information.